Terrorism and Emergency Response, Community and Public Health. Instructor Dr. Roxanne Bahari. Team C, Ashley Flannery, Sandra Hardison, Evita Edwards, Travis Farmer, Felicia Harden. Terrorism and Emergency Response. September 11, 2001, at 8:46 a.m. Eastern Standard Time, the first of the Twin Towers at the World Trade Center in New York was hit. Young adults between the ages of 18 through 30, both male and female, within multiple races in New York following the September 11th terrorist attack involving the World Trade Center, and the psychological effects for young adults in surrounding areas will be our target group. Young adults in the direct area were majorly affected in terms of respiratory infections and disorders, as well as the psychological effects such as post-traumatic stress disorder and an onset of sexual risk behavior, or substance abuse issues in some other cases. Decreased ability to smell was also a huge concern due to the high levels of air pollution affecting thousands in New York for around 6 months after the incident, which would also contribute to respiratory infection rates. Students in 3 separate North Carolina schools showed an uprising in PTSD, which is post-traumatic stress syndrome, symptoms, which was the most common health issue for young adults who were affected by the incident, including those who were geographically separated. There is a positive association between exposure to the attacks and symptoms of post-traumatic and global distress, as well as hopelessness and feelings of anger. Among the most helpful measures for young adults to release the stress caused by the events of September 11 are attending religious services, fundraising, and flying a flag, which seem to boost morale and patriotism in times of crisis. The risk factors. Within the young adult age group, substance abuse issues and sexual risk behaviors. Women were more likely to report depression than men after the attacks, which can be problematic when elevated stress levels show correlation and elevated unprotected sexual activity. Ethnic and racial minorities in urban or lower socioeconomic areas have less access to mental health care, thus taking longer to physiologically heal from attack than those in higher socioeconomical standing. For one study, the participants were all from high-risk areas with higher rates of violence, teen pregnancy, and HIV STDs, and their responses to the mental disorders attributed to the World Trade Center terrorist attacks. For another, 4,151 women aged 16 through 24 and unmarried were the main focus, along with sexual risk behavior caused by psychological traumas such as the World Trade Center attack. A third study in stress response among different age groups selected 670 young adults, only 493 of which responded for PTSD-like symptoms and responses. There are nearly always studies being undertaken on the effects of September 11, 2001 events, since it was the most shocking thing most Americans will ever experience, and the mass effect of the fallout hit everywhere, not just New York, not just within the United States. Monitoring the physical and mental health of those involved with the World Trade Center attacks is beneficial due to the necessity of mental health services. With monitoring the issues, we have the ability to offer services that will enable people to regain mental stability, so to speak. Policy development. Several studies to determine the full effects have been conducted. as well as starting up the World Trade Center Health, which is a program that monitors the health of people who were directly affected by the events of September 2001. Within 1 day of the attack, a free help hotline, LifeNet, was advertised for people to call for help or counseling, which snowballed into Project Liberty, which was actively advertised for over a year after the attacks. From 9/1 to 12/02, and more than $9 million was spent on Project Liberty, a media campaign encouraging people to seek counseling for the traumatic events of September 11, 2001 in New York City and the 5 boroughs and 10 communities in the direct area. Only 22 states required mental health care as of 2010. So there is definite improvement in that area for those who are suffering from post-traumatic stress or other psychological maladies as a result of the September 11 terrorist attack. In additional resources of the Affordable Care Act and the electronic medical records will make for tracking patterns and changes in mental health a lot easier, which will make providing treatment a lot easier. Potential facilitators: New York State Office of Mental Health. Since they've already been involved with Project Liberty, it is clear that the New York State Office of Mental Health is willing to educate and empower those who have been affected by trauma and tragedy. CDC. Since the Center for Disease Control is basically a giant information hive on all things public health related, their assistance in policy development for mental health in accordance with the Department of Health and the actual government for mental health awareness and availability of services, which is another thing that is supposed to be getting better with the Affordable Care Act. Our references. With information on how to address any mental health problems that may arise, it will be easier to combat the effects of depression. Agencies such as the CDC and most state or local health departments spend innumerable hours pushing for community education on health issues, especially those that can arise from mental disorders such as depression, which can cause more health risk and sexual risk behaviors, which has a high correlation with depression as stated above. Since mental illness has such a stigma in the United States, empowerment is especially important. Project Liberty, as an organization similar to it, are designed specifically to inform, educate, and empower those in need of counseling or mental health services to reach out and obtain the necessary help. Mobilizing community partnerships, bringing influential voices of the community into the campaign is beneficial because it spreads more information but also gains more support, so the issue and the offered services can gain a wider range of availability. Developing policies for terrorism and emergency responses, as well as the mental maladies that can be attached to them, will hopefully lessen the mass negative effects on the community or country as a whole. References as listed.